Welcome to the Veterans Impact Show, where our commitment is to help, hope, and healing of our veteran family and our nation. I'm Jim Blythe, a U.S. Navy veteran and a certified senior advisor. Join us as we continue the mission of leadership and commitment to our communities and our great country. Why, you never know where we're going to go or who you're going to meet. We invite you to join in, plug in, and share in what we do. This is your Veterans Impact Show. Welcome aboard, and today I've got a very special program. I am a Vietnam veteran, United States Navy, and I was affected, like so many veterans, by toxic poisonings, environmental problems. Today, I've got a really incredible opportunity to interview a great lady. So first of all, let me give you a little bit about a bio of this lady. Dr. Patricia Hastings, Colonel Dr. Patricia Hastings, U.S. Army. I got to tell you, man, those people are well trained. I won't go into the whole thing, but she is a United States Army Colonel, and she did receive the Defense Superior Service Medal for accomplishments in conditions for the military medicine while she was in the military. This is an amazing lady. So, Dr. Hastings, welcome aboard.
It's great to be here, Jim. Cedric, thank you so much for inviting me to be here and let the veterans know about the different military environmental exposures, the programs here at VA, and what we can do for veterans. As you noted, there are many military environmental exposures that have been present in every single conflict, and we are here to help veterans deal with those.
Well, you know, Dr. Hastings, before we get into that, I wanted to ask you about your career path and how you got into the Army and how you got into medicine. And the reason for that is I get so many questions from young people that I meet with. Gee, I can't afford to go to college. I want to be a medical professional. I want to be a doctor. I want to be a nurse. And I say to them, check with your recruiter because there are programs. You are a person who experienced those. So would you please tell us a little bit about your path to the United States Army?
Sure, I'd be happy to. And I would encourage anyone who wants to serve their nation to explore the military. And, you know, Marines, Air Force, Army, Navy, Coast Guard, there are so many opportunities to serve your nation. And it's an honor. I have had a career that has been amazing. It is something that I would not give up for anything in the world. I started out as a nurse. I went to nursing school in Iowa, and it was sort of one of those where the women in my family became nurses and the men went off to the military. I finished nursing school and wanted to go to med school. I would not have been able to pay for it, and so I applied, got into medical school, and the military, through the Health Professional Scholarship Program, paid for my education. I owed them time back, but I didn't owe them hundreds of thousands of dollars, which people may owe now. And you have a fabulous career. You have incredible opportunities to serve the nation, incredible opportunities to do unique things. I've worked in refugee camps. I have been in hospitals. I have worked in policy. The door is open through the military, and the fact that the nation is willing to pay for those people who want to serve and help them achieve a degree is just awesome. I would encourage anyone who's thinking about serving their nation to, you know, if you're in high school and college is difficult, use the GI Bill. It is there for you, and it is a unique entity that came about after World War II, very important. And then if you want to go on, just about any occupation is open to you. Now, medicine is where I want to stay, but it could be IT, it could be logistics, it could be just about anything. And, you know, certainly I would encourage everyone to think about nursing or medicine or many of the other ancillary fields in the medical field.
It really is. And I think one of the big things that Cedric and I talk about all the time, it teaches you leadership.
Exactly.
It also teaches you to observe, understand, overcome, adapt, get things done. And I think that's something very lacking that I hear in the workplace all the time. Employers say, gee, I want to hire a veteran because they know how to come in and they're going to say, how do you do this? No, they're going to say, listen, we're going to figure out a way to get this done and get it done right.
Right.
So I think it's important. The other thing a lot of people, and I had a friend of mine say the other day, man, this huge VA, it's the largest medical system in the United States. Do we really need it? And I said, let me make a point. Not only is the VA the largest medical system in the world, but 70% of American medical people who are employed have gone through the VA for some part of their training. 70%. Now, where we're going to be going with this discussion is about environmental issues, about environmental poisonings, exposures, etc. It's not just the military. It doesn't just happen in the military. Go back to Love Canal. Go back to explosions that have happened in refineries. Go back to things that have happened. It's across the board. And the VA is getting out in front of that. There's a lot of people who criticize and say, well, not soon enough. Hey, I got news for you. They're faster than anybody else because nobody else is going after it. So, Dr. Hastings, would you please explain a little bit about the vet home, the health outcomes, military exposure, and explain that so we can understand, because there's some things our veteran community really needs to know.
Can I jump back just a little bit, Jim, to focus on one of the things that you just said?
Yes, please.
70% or more of the healthcare professionals in the United States train at the VA. You're absolutely correct about that. And it is one of those things that the VA has been built specifically for the needs of veterans. And we are here for you. And if you look at the U.S. News and World Reports and look at many of the other articles that are in the peer-reviewed journals looking at healthcare for veterans, VA does a better job, has better outcomes for veterans than any other system in the United States. It is an important system. It's the system I use, and I'm very pleased with the care I have, and I'm sort of an informed consumer. But yes, the VA is here for you. There is not much that could replace us. It is one of the largest systems in the world, if not the largest, and it is very important to this nation.
Absolutely. And I got to tell you, when there are emergencies, the VA steps in. And I know that we have had that happen with hurricanes and other things. It's not just about supporting the military overseas. They support here in the United States. And during COVID, when it was at its height, the VA hospital opened up beds in the VA here in Dallas. And I know that happened in other facilities around the nation. So the VA isn't just for veterans. It's for the whole nation because what it does to bring things forward. Matter of fact, much of your cardiovascular surgery, from what I understand, was developed in the VA. The stent that I have was originally developed in the VA. I mean, you know, we figured out way back when how to use chicken wire and baling wire to get things done. So,
Duct tape.
Duct tape. Yeah.
You are absolutely correct. A lot of the research for this nation into antibiotics, into pacemakers, into exoskeletons for people who have been paralyzed have been developed at the VA. It is a unique treasure for this nation. And I would encourage veterans to enroll in VA healthcare if they have not already.
They are absolutely outstanding people, and I have known quite a few. I've actually met the secretaries of the VA. But let's talk about something that is really near and dear to my heart, because thanks to Michael Krause, who's the benefits director of the VA in Texas, he drugged me in after I did a live interview and said, you need to sign up for the PACT Act. I said, well, Michael, I was at sea. He said, no, you need to sign up. You've got 3 of the presumptive conditions for toxic poisoning. Come to find out, I did. I do. And we're working on it. And I've gotten a godsend because they provided some money, the back pay, which paid for my cancer treatments. So, man, I'm very beholden. You guys did a fabulous job. So let's talk about, for instance, the Vet Home program and what's going on there
Sure.
and how we can help veterans.
Absolutely. Military environmental exposures are in every conflict since the beginning of time, unfortunately. Since the time of the Romans, they used poisoned arrows, they used the Greek fire. Unfortunately, man is very creative at weaponry. And the unfortunate reality of that is you do need to have it to protect your nation, but you also have to be able, as Abraham Lincoln said, to take care of those who have served and their widow and their orphan. And so VA is here for those things. Military environmental exposures are recognized. Some of the first presumptions were put together in the 1920s, looking at the mental health issues of, at that time, we didn't call it post-traumatic stress disorder. We called it shell shock or nostalgia. We had other terms for it, but we recognized that people needed help returning and reintegrating. We also looked at infectious diseases because there were some infectious diseases that were presumptions because it was going to be unlikely that you would have dengue, malaria, or some other conditions without that deployment to an area where it was endemic. So we've had presumptions for a long time. We've had the Agent Orange presumptions for the military environmental exposure of dioxin from Agent Orange since the 90s. We have expanded so many things that we are studying right now because there are the concerns with cancers, there are concerns with respiratory problems, and so we look at all those things. We don't have an answer for Gulf War illness yet and what causes that, but we saw after the Gulf War, people came back and they were suffering. And so we have studied that and we have great ways of treating it, even though we don't know exactly what may have caused it. In the current conflict, the issue here is particulate matter pollution. People worry about the burn pits, but it's not so much even the burn pits, it's the dust and the particulate matter from the Southwest Asia Theater of Operations, a very dry desert environment. And so we have studied those things that aren't necessarily a toxic exposure as such, being the particulate matter, but it is a military environmental exposure with huge consequences for people that may have been exposed. So to get this out in a word, we are studying the consequences of military environmental exposures so that we can best care for veterans and make sure that they have the care, the benefits that they have earned and deserve.
Jordan, put up that slide, please, about Vet Home that's on the screen and let everybody know. So this is from a webinar that was done in Colorado, but it really talks about what they're doing, the intake center, and then what they're going through with the 40 clinicians to really understand this. May I suggest, though, that we let Dr. Hastings, you continue your conversation about what they're doing.
We are so excited about Vet Home, and this is the Veteran Exposure Team Health Outcomes Military Exposures. We recognize that at each VA medical center, there is an environmental health coordinator to help walk veterans through this. And it is on our website. If you look at www.publichealth.va.gov and go to the index, you will see under E, Environmental Health Coordinators, and they can help you with this journey. You can see a clinician at your local VA medical center. But for many veterans, it was difficult, especially the rural veterans, the veterans who might not be close to a medical center, or the veterans where we needed to have an upper level of review. And so we put together Vet Home, and it was under the current Secretary McDonough, who said, we need to do this better, and he gave us the permission to put together Vet Home. So if a veteran would call the number for Vet Home, and I know you'll put up the website at the end, but the number is 833-633-8846. They can call and make an appointment. At the intake center, there are nurses and administrators that will help get them ready for their appointment with one of the clinicians. And these are our healthcare providers, doctors, nurse practitioners, physicians assistants, who are specially trained in military environmental exposures. I would like to note that we also have clinicians that are specially trained at all the VA medical centers to deal with military environmental exposures. But Vet Home was put together specifically to look at the concerns of veterans. You know, with the toxic exposure screen, which was mandated by the PACT Act, so that we can find out how large this issue is, 42% of veterans endorse the fact that they believe they have had exposure, a military environmental exposure that may affect their health and affects their health either now or they're concerned that it may in the future.
It's a big thing, Cedric.
Yeah, I was going to ask Dr. Hastings. I have had two guys to call my office. I was in the Navy. I was a gunner's mate missile technician, and we played. Of course, we practiced. Right, you prepare for battle in a time of peace. One of the questions that I received was in reference to the AFFF. I don't know if you're familiar with it, the Aquarius film forming foam, and is that covered under the PACT Act, or would that be something else?
It is not covered under the PACT Act, but in the PACT Act, VA is allowed to look at military environmental exposures, and we are able to do presumptions. They don't necessarily have to be legislated by Congress. And we have a Federal Register notice that is out right now that if people look up PFAS, the perfluorinated compounds, or they look up AFFF, firefighting foam, Federal Register notice, they would be able to go in and make comments until the 20th of December. We just had a listening session because we are going to be looking at PFAS in the next year, the aqueous firefighting foam, the AFFF, and look at it as it may be related to kidney cancer. Now, there are other conditions that may be related, thyroid disorders, immune problems, liver problems. So we will be looking at those in the future, but right now, a concerted effort to look at kidney cancer and other cancers.
Okay.
That's huge because I was in every firefighting school the Navy had. Plus, I flew as flight crew for a while, and I was in a problem accident that happened on a runway with a A4 Skyhawk. And we turned into a fireball thanks to a flat tire. And the net result was we got soaked in that stuff. Now, when it happened, listen, all I could think of is thank God they're here.
Right.
Now I look back and I go, oh boy, what did they soak us in? I mean, we were soaked in that stuff. So you need to find out. That's why you need to be involved in this.
Absolutely. And I will note that I do agree with you. At the time I turned into a fireball, I would have said, thank God they're here. But we do need to look at the consequences. And I will note that PFAS, the firefighting foam equivalents, are in many things that they are in your stain-resistant carpeting, they are in your raincoat, they are water repellent in your shoes. They were used to degrease paper that would wrap food. I know that they were in the Jiffy popcorn little fry pans that they had, and I would lick the inside of that, not realizing that at the time that it was probably, there was PFAS there. So there are many places, but the firefighting foam is one of the major contributors.
All right, we're going to take a break to hear from our sponsors real quick. This is Jim Blythe and Cedric White talking with Dr. Hastings, VA Healthcare. We're talking about you. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation. We're talking with Dr. Colonel, or is it Colonel Doctor? I can't always remember. I think it's Colonel Doctor, isn't it? Hastings?
I usually go by Pat.
Oh,
okay, that simplifies it.
I love it. I have a number of flag-ranked officer friends, and they give me a hard time sometimes about referring to their rank, and so I understand. This is really, really important because this came under the PACT Act. A lot of people say, well, why would I want to sign up for something like that? Well, if you do, they're going to do a medical evaluation. they didn't do what I thought was maybe going to happen of testing and drawing blood and all that. They just went over my records and they said, yeah, you were there. Yeah, I was there 3 times. And I really, really have been amazed at the result and what happened as a result of the PACT Act. I don't know of any civilian situation that's doing the same thing to go into the depth and detail as our VA medical system is doing. And that will spill over to the civilian world. So we're talking about, and I put this up, Jordan, if you can put this up, these are the things that they're talking about. We're talking about the Agent Orange Registry, the airborne hazards, open burn pits, depleted uranium follow-up. You know what? It's crazy, but I volunteered as a bomb loader, even though I was maintenance administration, and I was around nuclear weapons more than once. Gulf War Registry, ionized radiation registry, toxic embedded fragment surveillance. There's all of these things. They're trying to gather information. So the myth is, oh, well, you know, why should I do this? Why should I do this? They're going to just get my information. No, it's not going to affect you negatively in any way, shape, or form. And it is a benefit not only to you, but to every veteran and, quite frankly, long-term, the civilians in the United States, because there will be another Love Canal. There will be another train wreck somewhere. And what I have actually seen a real train wreck, and I heard on the police radio, everybody run like hell. One of the cars exploded is hydrogen chloride or something. I talk about a big cloud of poisonous gas coming loose here in Dallas. So these things are important. And Dr. Hastings, your background in emergency medicine and your background in all these things, you not only are unique, but what you said to me earlier is they've put together a task force of people that are especially trained to deal with this. Can you elaborate just a little bit on that?
Absolutely. And I would also like to note that you said sign up for the PACT Act and what could it do for you? The PACT Act has 23 presumptions that were added by Congress. But this isn't just 23 presumptions, it's 23 buckets of presumptions because it's head and neck cancers of any type, respiratory cancers of any type, digestive cancers of any type. And I added them up because the president was thinking about using some of this in the State of the Union address. So I counted up all of the different conditions, and I'm sure I didn't get all of them, but there were over 700 different conditions and cancers that are covered by the PACT Act now. And you alluded to the fact that, you know, why would you want to be involved in a registry? Well, the registry helps us study the healthcare outcomes, very important. And it could help you, but even more important, it could help your battle buddy. Because we are looking at following people over time. For example, we're looking at the people who were at Karshi-Khanabad, which was in Uzbekistan, and the concerns that they have with exposures there. We will be following them for decades and making sure that we are able to get answers for veterans, put presumptions forward when needed, and make sure that we address illnesses or conditions, hopefully before they are too far to be treated. But again, if you enroll in one of the registries, you not only help VA do research and possibly help yourself, but you are helping your battle buddies. And as Jim said, it will carry over to the nation.
Absolutely. And this is critically important. Again, one of the things that I like about the VA is that they peel back the onion. When you start talking about medical, you go in for a heart problem and they're going to be taking a look at all of these things and they're going to go, wait a minute, this is a presumptive condition for this, so we need to look deeper and see what else may be involved. When you go to a hospital, civilian hospital, they do everything you can to get you out in 3 to 4 days, correct? I mean, that's what happens in civilian. In the military, you stay there till they know you're safe to go home. Am I not correct, Dr. Hastings?
No, you're absolutely correct. Unfortunately, the payers in the civilian world use the diagnostic related groups, the DRGs, to determine what payments are, and there are economic incentives that are a little bit different than the DoD or VA.
And this is really important. So we want to keep talking about this, and we want to come back after these messages. I got to tell you, I work for Fairway Independent Mortgage. We provide service dogs to veterans. They are a sponsor of this program. We are a very veteran-friendly organization. We're the largest non-bank mortgage company in the United States. So take a look at Fairway Independent Mortgage. I'm one of their members who is a loan originator. We'll come back and talk more about that later. But for now, we're talking with Dr. Hastings about some really important things you need to know about. So stay with us. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation. Well, I'm having a great time. Dr. Hastings, in your opinion, why do you think veterans don't want to go to the VA? Because I hear it all the time, and I just about have to browbeat them, and yet they always come back and say, gee, I wish I'd done this before. What can we do to encourage them to go to the VA and get health care and get checked out?
I was that guy.
Oh, you were that guy?
I was that guy. My son spent about 4 years trying to, Dad, you need to go to the VA. And I was like, well, I'm okay. And so I was that guy that once I finally went and started getting treatment, I wish I had gone much earlier. So I was that guy. So it would behoove, and Dr. Hastings, maybe you can give us some help, incentivize some guys to go ahead and step up and get the help that they need.
Absolutely. You don't have, I mean, some people may say that they have healthcare in other places, but you know what? It's nice to have the VA as backup.
Yes.
You don't have to get all your healthcare there. You could get just your glasses, your hearing aids, or medications there. But I would say sign up and get your healthcare there because, again, as I noted before, VA has better health outcomes for veterans than any other system in the United States. I think there are myths about the VA that unfortunately get passed on, and I think it's a misunderstanding that people have. And I have not heard anyone say that they are unhappy with VA healthcare once they have decided to enroll. Now, there are, little irritations like there are with many things. Your medications may not show up fast enough in the mail. You may have to wait a little bit for an appointment. But on the civilian side, the routine wait time for a specialist is about 90 days, and VA is faster than that. So again, I would enroll in VA healthcare and have it as that backup. If you have healthcare that you like now, that's great, but it's good to have VA in your back pocket and then to consider using it even more.
I've got my VA card right next to my United Health card. So I've got both. I didn't sign up for it because I didn't think highly of it or anything. I just never thought about it. When I got to be 65, I was covered under corporate, which was outstanding. Then I got covered under Medicare. That was great. Finally, when this PACT Act thing came and Michael Krause got me involved, I'm like, wow. So I'm signed up. I've got a great healthcare provider. Yes, I get calls from all over the nation saying, well, I've got this problem or I've got that problem. Generally speaking, you can work them out. Sometimes you can, sometimes you can't. But it's better than nothing. And it's better than what you're going to find in many of the civilian situations because...
And I was so sorry to walk on you.
Go right ahead.
I was just going to say there are people in VA specifically there to take care of issues that you have. There is a veteran experience officer at every single VA medical center. They are available online. They are available on the phone. They are available in person. And if you have a problem, they are there to solve it for you. And in the claim side of the house, VA has a duty to assist. So if you are putting in a claim, VA has a duty to assist you with that claim. So there are lots of ways to make sure that you are getting the services that are required. And if there is a little bit of a bureaucratic hurdle, there are people here to help you over that.
I want to tell a story real quick. I had a call from Richmond, Virginia. Actually, it was somebody from Dallas that I knew, and they knew me, and they'd heard my program a number of times. And so they called me and she said, I'm taking care of my dad, who's a World War II veteran. This was several years ago. And he's in really bad shape, and all he's got is Social Security, and we're really struggling. I connected her, thanks to a county veteran service officer in Dallas, to a DAV member who is a VA accredited rep. They cannot charge, okay? So it's a free service, and they did all the paperwork. All of the complaints that I've always heard has to do with, man, the paperwork is so tough, Jim. I said, wait a minute. You were in the military. Paperwork is what drove us all nuts. That's part of the government. But there are specialists called VA accredited reps to help people get it done. This gentleman was bedridden, had all of the problems. He qualified for the aid and attendance, and he got it. And he got it within weeks. And it helped that family enormously. So if that's a good story, and I hear bad stories all the time, and usually there's something behind it, but I hear bad stories, but I got to tell you, I hear more good stories than bad stories. So again, I encourage people. The other thing I want to encourage our American public, the civilian, get behind and support the VA. One of the things right now is with the VA and with the PACT Act and the things that they're uncovering, I'm going to tell you, I'm probably speaking out of turn. But the VA has had to come back around and ask for additional funding in the budget. Let me tell you, that is money well spent. That is money that goes back into our nation in terms of medical care, in terms of employment, and in terms of research that saves lives. Mm-hmm. So I would get with my congressman and say, support the VA healthcare system. Support what is needed to financially do that, because it's not just for veterans, it's for this whole nation. I'll get off my soapbox.
Well, you make a good point, though, Jim. The support is needed. And as Dr. Hastings said, there's a lot of misnomers that are out there about the VA. And again, I was one of those people who said, I don't need it. I'd heard negative things about it. But once I did, it did take a little paperwork. But once I did go in and submitted my paperwork, I was in, and actually, Dr. Hastings, my medications come they're distributed in a very timely manner. So I feel sorry for anybody who's having problems, but mine show up consistently and on time. So I appreciate the veteran benefits.
Yeah, and
my medicine's always
yes,
been on
ma'am.
time too.
Yeah. Matter of fact, Dr. Stephen Holt, who's a good, close friend of mine. He told me that when he came to Dallas to the VA, they took one look at him and said, let's do a health analysis. They put him on a diet, exercise program. He had high blood pressure. I mean, he was a retired U.S. Air Force colonel, medical doctor. And they said, you need to do these things. He's doing great now. He said to me one time, hadn't been for that, I might not be here. That's true. Mm-hmm. Hadn't been for checking on all of these things. If it hadn't been for that, there's going to be a whole lot more people that would say, gee, I wouldn't be here if it hadn't been for that. So again, with the Vet Home, we've given you the website. We've given you, and you can put up the website, Jordan, for disability claims. Get in touch with the VA. I don't care what you've heard in the past. I don't care. Focus on you and taking care of you, and that's an important thing to do. And many of these toxic things, we're going to have them. We're going to continue. We're going to have them here anywhere in the world. It's not just military. What are some of the other things you think we ought to know about this, Dr. Hastings?
Well, you've touched on the research that VA does, exceedingly important. You've touched on the fact that Vet Home is there to put forward an understanding for the veterans about military environmental exposures, things they can do to stay healthy. Notes also go into the veteran's record so that these things are documented. And they also put care plans together so that the healthcare provider and the veteran can work as a team to stay as healthy as possible. VA also is working very diligently on expanding exposure-informed care. Whole health is very important, and we want to add exposure-informed care to that so that every single veteran that comes in, we explore their possibility of the military environmental exposures, because unfortunately the military, working in the military, there are so many exposures that can occur. So that is expanding. What other things would I like to talk about?
May I ask a question? I saw somewhere in all of this wonderful material about trained military environmental exposure specialists. Where do you get the training for that? Because you said you have 40 clinicians around the United States for this. Can you explain that and how? Because if somebody says, gee, I'd like to have a career in medical, I'd like to look at this. Is this a new facet of the medical profession? And if so, how can people train for it?
It's not new. In the civilian world, there are occupational medicine specialists. Not very many of them. It's a unique specialty. VA put together training because it is so important to make sure that our providers understand military environmental exposures. And in fact, the training that we've put together has been recognized by the Centers for Disease Control in Atlanta. They've put it on their website. It was seen by the American College of Preventive Medicine, and they asked VA, could we partner with you and take your materials and put them on our website and train civilians and offer a certification. So the VA materials were so highly evolved that the American College of Preventive Medicine wanted to use them. We're really pleased with that and very excited. So we have level 1 and level 2 training. Level 1, it gets you to entry-level understanding, and level 2 is entry-level competence. As you may imagine, people don't get trained about environmental exposures or military environmental exposures in medical school, PA school, nurse practitioner school. So VA had to look ahead and say, what is it we need to do for veterans? And training was critical and supported by VA.
It is. Again, I want to make another point. For instance, here in Texas, we have a great deal of petrochemical plants. We have a great deal, both petrochemical plants who provide chemicals and those who do refining for oil and gas related products. With a petrochemical plant, all it takes is the wrong valve being opened and the plant can go up in smoke. Believe me, I went down and I was talking with the people at the Phillips chemical plant, and back in, I think in the 70s, a young laborer was not understanding what was going on, and he opened a valve, and that chemical, when it hit ambient air, exploded, took out acres and acres and acres of chemical plants and created a cloud of toxic smoke that was unbelievable. We've had fires in the channels. We had a big fire down in West Texas in a fertilizer plant, of all things. Right. So these things that we're talking about, while the VA is military, says veteran, these are happening in our world, and they have for, I guess, how far back do you want to go? And it's not always petrochemical. It could be something else. Like I say, Love Canal. How about maybe a volcano creates this? So having these toxic environmental trained people may end up being one of the greatest things this country ever did, simply because There's so many more of us now, and when something happens, I tell you what, there was a small town in Oklahoma, and I think their water supply really got contaminated,
Right.
and everybody in town got cancer. Having the kind of professionals you're talking about that are trained by the VA could have made a big difference in that town. What do you think, Dr. Hastings?
I think another big difference is public health across the nation, and not just at VA, but public health across the nation needs to be supported, because if you see cancer clusters, if you catch them early, you can take care of people much better, and you can stop the cancer clusters. You can address the issue and find it earlier. So not only the things that VA is doing, but the things that the nation needs to support. Absolutely agree with you. Public health is of critical importance.
If not now, when are we going to get after it? And the VA is now doing that. The VA is taking action that the civilian maybe not quite so much. You may disagree with me there, but I do see the VA doing a lot to try and not only help veterans, but they're going to help the civilian population. And when you talk about Agent Orange, this has been a very, very toxic conversation for a very long time. And a lot of people say it went too long. Well, yeah, it did. But we're talking about it, have been talking about it, and understanding it. And yes, too many people died. I'm glad that we are now getting after not only the toxic that happened with Agent Orange, but the burn pits, the other things. And understanding that is going to be a big thing. What can we do to help you?
Yeah, I was going to say, with Agent Orange, there was not an understanding of the fact that there were dioxins in it as a contaminant. But when it was recognized very quickly, Congress and VA started to address it. So that was in the 90s. And yes, it was 15 years later than you would want it to be. And we did learn that lesson, especially with Gulf War. People came back, they were sick. We said something is wrong and began investigating it right away. With the burn pits, we started seeing some signs in about 2008 and jumped on it with National Academy of Sciences, Engineering, and Medicine reports, as well as our own VA surveillance, which led to the first presumptions that came out of VA, that being asthma, rhinitis, sinusitis. We didn't have cancers at that time, which have been legislated. And people said, well, why didn't you look at cancers? Well, of course, cancers have a latency period, take a while to manifest. And many people had asthma, rhinitis, sinusitis, which are quality of life issues. And actually, in the case of asthma, for sure, can be killers. So VA has learned to respond to these. Some of these were the lessons learned from the 20s when we were looking at PTSD. Some of it was from the 90s when we really started looking at Agent Orange. But we have about 40 different cohorts that we are monitoring now, that we follow here at VA in my office to see if there are any trends so that we can catch them early. And that is one of the things that I think my office is especially good at, making sure that the surveillance is there, that we find the trends early, and we look at the need for presumption.
And catching them early. Dr. Hastings, we're going to be right back after a couple of words from our sponsors. And I want to thank you for all you're talking about, and thank you for what you're doing. And when we come back, we're going to emphasize again the phone number and the website to be able to get a hold of the VA and get help. This is Veterans Impact Show, here for you. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation. This has not necessarily been a fun conversation because we're talking about health issues, but it's
very
been
informative.
Very. And that's what we're here to do, is help veterans heal, as well as help this nation heal and come back together. That's really important. I want to give out the contact number again for the Vet Home. You can go to the VA. It's vethome.va.gov, www.vethome.va.gov. Telephone number is 833-633-8846. That's important that you sign up for the PACT Act if you haven't and you qualify. It's important that you understand what's going on. It's also important that you get into the VA healthcare system because it can change your life. It can help you. It helped me. It's helped you.
Yes.
It's helped Dr. Hastings. It's helped Dr. Holt. How many more do you want to know? But I am going to also say anything that big makes mistakes, but they do try and correct them as best they can. And so, yeah, so go to your veterans experience. My wife's giving me some background over here. So, you know, she is the best producer and keeps me on track. So I'm very blessed.
Does a great
Veterans
job.
Experience Officer. Thank you. Dr. Hastings, Army Colonel, medical doctor, all of your education paid for by the U.S. Army. Well, what would you say to a young couple? What would you say to a young man or woman? What would you say to a father and mother who are saying, gee, I want my kid to have a great education. I want him to have a great start in life. You did it. What would you say to them?
I would say that if you want to serve your country and want to have a great career, and you're in high school, you haven't decided on which college, or maybe like me, you don't have the funds to pay for college, consider joining the military, using the GI Bill. It opens up an entire world for you, and it is a unique career. I would not, as I said in the beginning, have changed anything. Working and serving the nation, and when I retired, I wanted to continue serving the nation. I came to VA. But I would tell young people, I would tell their parents that it is exciting, it is important, and it is one of the things that you will treasure your entire life.
Without a doubt.
Exactly.
I had a great time, got to travel the world, join the Navy and see the world. Join the Army and you'll see some world too. We've got to give you a little bit of a hard time, you know. Army, go Navy. You know who wins that game? The TV stations.
Let me put it to you this: when I worked in the Pentagon, the Navy marched by the Army halls a lot with their brass band to lord it over us.
Well, there will be a day that turnabout is fair play. And I want to thank you very much. Again, we want people to go to the website. If you don't understand or you think, well, the PACT Act is baloney, no, go get someone who is a VA accredited rep. If you're in Texas, there is a county veteran service officer. Some states in the union have officers like that, but you can go to VFW, you can go to American Legion, you can go to DAV. Those three typically have embedded in their local organizations a VA accredited rep. Now, there are VA accredited reps that are attorneys, but they will charge you, and that's illegal. So what we want you to do is go to and find what you can do to get yourself in and get help. And take a look again at this registry because it's real important. You want to go to Vet Home. So that's Vet Home, www.vethome.va.gov. Correct?
That's it.
Cedric?
That's it.
I got to tell you, this has been a great show, and thank you so much for being a part of it. We've got a minute or two. I want to say a special thank you to DBTV Network and AUN for putting us on the internet, for putting us in their TV networks. I want to say a special thank you to Fairway Independent Mortgage. Their NMLS number is 2289. Mine's 33548. I couldn't remember. And we're at 350 Cedar Sage here in Dallas, or Garland, Texas. We are an equal opportunity lender, as well as Symbiosis Integrative Health and what they do to help and restore veterans. This is a great opportunity. Share this. Get the word out. If you know a veteran who's in pain, who's complaining, who needs help, get them this, you tell them, go watch this YouTube video. You're going to learn a lot. If they have served overseas or even Camp Lejeune or some of the other places where there's toxic exposure, get them in there, because what they might find out is they might find a condition before it gets too late. Just as Dr. Hastings said, the sooner you know, the better you are. I was diagnosed with early stages of prostate cancer. We caught it real quick. We're getting it taken care of without having to do surgery. That's an important thing. You do not want to let things get away. So I want to say thank you again. Cedric, you are my minister, as well as my co-host and partner.
Yes, sir.
I think we should close with a quick prayer to say thank you to all that's doing and going, and a special prayer for protection of the holidays.
Will do. So, Father, we thank you for this day. We thank you for those like Dr. Hastings who are working for our veterans. We thank you for the resources and the support that they give to our military and our veterans. We ask that you watch over us as we go forth, keep us as we celebrate and travel to visit with families, or as we enter into the holiday seasons. We thank you for this great country that's greater than any other country on earth. And let us always remain to be that country that is one nation, under God, indivisible, with liberty and justice for all. In Jesus' name, amen.
Amen. Dr. Hastings, thank you again. And thank you to Kevin, your PAO, who helped me put this together. And tell Dr. Moore we're sorry she's sick. We'll pray for her as well. Thank you again. You have a wonderful holiday. I mean, a great holiday.
No, thank you so much for inviting us. Thank you for getting an important message out. And do I have time for one more thing?
Quickly.
5 seconds. Okay,
5 seconds.
www.publichealth.va.gov. That will give you many of the different military environmental exposures. It'll take you to the PACT Act, and it's very easy to enroll in VA care, and you'll get that information there.
All right, we'll make sure that's in the program. Thank you again, Dr. Hastings.
Thank you, Dr.
Have a
Hastings.
blessed holiday.
God bless.
Bye-bye.
Thank you.